Thank you both, Krista and Mark. Those were, we got very good comments and insights. Now I want to invite all the panel members, the speaking and the non-speaking ones, up to the table. And we've done quite well on time. We have about 40 minutes or so. What I would like to do is have kind of 3 rounds of questions. We have a number of participants virtually. And Simone, I think you're capturing some of their input. So we'll start from the room and we'll take 3 or 4 questions for the panel. And then panel members, you don't have to feel obliged to deal with every point. I'll leave it to your judgment to prioritize and embellish. And then we'll go on from there. So we'll collect 3 or 4 things, then we'll turn over to the panel, etc. Yes, please.
Thank you very much for the presentation. My name is Aida Murad. I'm coming from Winrock International, where we're implementing the Feed the Future women's empowerment activity in Bangladesh. My question is, we talk about this women's time and men's time, but what about the extended family? Because I know in these cultures, in the developing world, such as Bangladesh, the grandparents play a huge role in time, the time use of the women especially. So just wanted to hear your thoughts on that. Thank you very much.
Okay. Is there other? Emmy? Oh, well, oh. Yeah. And then we'll go to this side.
I have a question about the data gathering going forward, because I think everyone sort of said we really need to pay attention to this and to spend time doing it, but it's difficult. I think both Deborah and Mark emphasized how hard this is to collect time use data. I'm wondering if, in fact, in doing the review, you found any particularly good examples of way to structure data gathering so that, in fact, there could be kind of a systematic structure for accumulating this data so that that various studies could do it and it would be comparable. Because one of the things that I've noticed in looking at various studies is they all have different methodologies. They all have different ways of recording simultaneity, for example. Many people get really fed up and don't deal with the seasonality issue because it's so goddamn hard to do these studies. So I just wondered if you had any ideas about how this could be made more sort of like the Women's Empowerment in Agriculture Index, more kind of standardized, so that we could, say over the next 3 or 4 years, really target accumulating a better database on women's time use, men's time use, and I would also suggest kids' time use.
Okay. So here and then here. That gentleman with the over there, and then in the back, Jeff.
Brian Bruns, a sociologist who works on water management, and sounds like a very nicely done study. Since it hasn't come up specifically, interested if you could say some things, particularly about childcare, preschool, after school, as a coping, mechanism in some ways that communities and households don't necessarily just wait for government, but policy can also support. And specifically in terms of further research, to what extent kind of time use studies in general you would see compared to specifically using randomized controlled trials or other narrower techniques. Thank you.
Okay. And right at the back, Simone, Jeff.
Jeff Leroy from IFPRI. Following up on that question, a couple of years ago we reviewed the evidence on the relation between provision of childcare and outcomes in children, health, nutrition, and development. And I was a little surprised, and I haven't read the report obviously, that it didn't come out as a literature that was connected to in this review, because it seems like a critical piece that needs to be resolved if we want these women to spend more time in either agriculture or nutrition.
Okay. So kind of 3 types of questions, big ones around childcare, then the ones around data, and then the ones around what other extended family and other types of things. So I don't know how you want to divide those up.
I think it would be really nice to actually start with the question. I think it would be very nice to actually start with a question on data, and I wanted to hand to my colleague Sarah, who perhaps could talk a bit about how data can be collected in a better way?
Yes, so hi everyone. So I'm going to answer the question in a minute. I just would like to thank the organizers of the event for making this possible. So yes, like we have looked in detail at issues that have to do with the quality of time use data and how the collection of time use data can be improved in future research. As this, was the central component, of all of the studies we've looked at, whether they were on agriculture and time use or on time use and nutrition. We have actually, I don't know if it's possible, like we had anticipated that this sort of question could come up. So we have some additional slides that perhaps we could show. I don't know if that is too complicated. But yes, like in the meantime, I'll keep talking. So we have worked, we have received advice from an advisory group, and some experts, international experts on time use research, and using their advice, and at the same time reviewing, the literature on how to collect time use data, especially in low and middle income countries, which was, the focus of our study. We have drawn a sort of checklist to assess the quality of time use data. And no, okay, we can't.
I can
we
see
cannot
it.
have.
I don't think anybody else
It's okay.
can.
It's okay. Thank you.
I don't know if we could swap the. Yeah, okay, good. So it'll come up in a minute.
Yes. So we, there are different issues that I would like to highlight. So we have included studies that looked, that sort of carried out comprehensive investigations of time use or detailed investigation of time use, spent on particular activities. So that was the first criterion that we used in order to judge, to assess the quality of that data, whether the objective of the study was, a sort of comprehensive investigation of time use or a detailed, a more specific one. And the other characteristics that we have looked at is whether simultaneous activities, as Krista mentioned, in her presentation, whether simultaneous activities were recorded, and actually, this was an area where, the quality of time use data that we have reviewed, was particularly low. And whether, contextual or background information was collected together with time use data in order to increase the opportunities, to analyze, and understand, in more comprehensive ways, what time use data tells us.
Yeah,
oh, fantastic.
So the kind of questions you asked, and then the overall assessment.
I think, yes, exactly. So it's okay. I'll come on to that, in a second. And I think that there are some issues that have to do with the consideration for literacy levels, especially in the context of low and middle income countries. So that was another aspect of time use data that we looked at, whether, we use the sort of interview-based methods or surveys to collect data in contexts where lives are not necessarily organized by the clock. And so, the respondents may have more difficulties in defining how many hours they spent, on particular activities. What you can see here, and perhaps, I'll draw your attention, to the first row of this diagram. Is that 64% of the evidence that we had in our review was classified as being of low quality in relation to the time use component of the studies. At 20% is sort of medium quality, and only a 16% is high quality. And I would like to say, I think that there are two issues, and I think it's linked to the point that, again, Krista was making, and also Mark picked up on the difference between data missing data or missing analysis of certain aspects. So I think that some of the studies that were classified as low quality in terms of time use data perhaps collected good data, but they didn't report sufficient details in the studies that we looked at, and therefore, like, we couldn't give an accurate answer, you know, like, to some of the criteria, like, in questions that we were looking at. So that is something, you know, like, quite important to think about. And in terms of, you know, like, good examples and how time use data collection can be improved in future research. So I think, you know, like, I would like to mention a couple of things. One is that of, you know, like, the 89 studies that we looked at, only one used the data from a national time use survey. And this is quite surprising, if you want. And nowadays, I mean, there are a number of countries that have conducted this type of survey. And so perhaps, you know, like, that is data, you know, like, that is collected, you know, like, taking into account, like, simultaneous activities, background information, and literacy levels. So that is something, perhaps, you know, like, that is evidence that is there and that could be used more, like, in this type of research. And the last thing that I would like to say is related, you know, like, to the importance of small-scale surveys and qualitative evidence in the collection of time use data, and especially, like, on the importance of direct observation to collect time use data, especially to overcome, you know, like, those issues, like, of reliability and accuracy of information in contexts, you know, like, where this may be, you know, like, a more difficult information to collect. So
Thank you, Sarah, for that comprehensive answer. Childcare, who wants to tackle that?
I can address. I'll respond to the first question on extended family, which is a really crucial issue, and of course highlights the fact of you know, thinking about what do we even mean by the household, and of course as your question implies, household composition is not uniform, and nor are gendered aspects in the allocation of time necessarily determined by the conjugal relationship, but also grandparents, as you say, have an important role to play, as do younger women. So when we're thinking about time allocation, we're thinking also about the distribution of task allocation across family members. And this is really interesting. In one of the studies that came up, where one agricultural intervention was the introduction of cereal mills into a village, what actually unfolded was that the reduction in time saving for women actually saved less time than was predicted, and what the data then revealed was that this was to do with the fact that cooking is spread across a number of different people, among several wives, in fact, because it's a polygamous community. So several wives were taking on the responsibility of cooking, meaning that the time saved was spread across a number of people. So, you know, this is a really crucial factor that's been picked up in this study.
Okay. Krista and Mark, do you want to jump in with anything?
Add on to that. And I'm sorry I won't be able to look at you as I respond to your question. So I think, so one point about that is not only, you know, who's in the household, who's in the family, but also who in the community are people using and turning to. Are there any even informal services? Lots of women I've talked with do, you know, informal labor sharing. Someone is off, you know, watching the child, they take turns. So there are also mechanisms outside the household that you may not be able to capture in time use, so you might have to ask about separately. I think looking across household members, ultimately practically becomes a data issue. So first is, do we already understand enough about what different kinds of people in the household are already doing with their time? And then it gets down to, what do we want to ask them? And I think Mark had a really great point. Do we know what are the activities that are important for time to be spent in nutrition? So I always have a survey design going on in the back of my mind. So when I hear your question, I'm thinking, well, now I have to ask a lot more people in the household or in the community if I'm going qualitative. So I really better know what's important to be asking them so that I can minimize the time. For the child care, it's very important, and again, it's something I don't think we have enough evidence on because it is often a mix of very informal strategies and not reported. We're seeing, again, things like people, working in groups together, someone watches the child, another wife watches the child. We're seeing, but not yet evaluating in 1,000-day communities where we're really focusing on conception to those first 3 years. Who is providing care? What is is the child care of good quality? Is it clean? Is it safe? Is the child getting fed? So those are all other things that are a part of that linkage as well.
Okay.
I am a bit of a data dissident, I must say, on time use. And the reason for that is the likelihood of getting nationally representative, statistically appropriate surveys of time use are very low. I was really happy to see in the bibliography of this review the reference to Elsa Schonsberg's study of 1989 from a Kefa village in Zambia. This, to my mind, should be required reading for development practitioners. Now, it speaks about how people use time in this village, and my interest in this has much more to do with what are the insights that one can obtain for what people do and how they do it, rather than necessarily holding out for some rigorous perfection that you're not going to get. And this book is phenomenally insightful. Thanks.
Thank you, Mark. Deborah, do you want to have a final word?
I think I was going to add to the childcare, but also answer that question on, well, what kind of study, better time use data or an RCT? And I think, because I think we can draw it together, very much picking up on what Krista said. What was interesting is we didn't find a large number of studies on the impact of changes to childcare and then sort of subsequent nutritional outcomes. And one reason for that was that I think where things were coming up, often they were urban, and for that reason we excluded them. So there is a real data gap, and there's a real need for, more primary evidence to be out there. The other issue is, of course, the complex one, that also what happened when childcare changed was really hard to unpick. Was it good to have a substitute child carer? Some evidence was that it was fine, and in other cases, concerns were raised. And this is important because one of our recommendations is that one way to deal with time burdens is to improve services which are available, and those could be childcare services. But of course, we have to say, well, is it a good thing? Is it going to be, as Mark said, the crucial thing that improves nutritional outcomes? So it's a good question to be raised, and I wish that we'd had a lot more evidence on that. But back to the quality of evidence. What's the best kind of evidence? And I think something I wanted that I think is really picking up on what everyone has said is that these things are really complicated. Yes, we have the gold standard of an RCT, but what we found often was most useful in understanding how something worked were those smaller qualitative studies. So I guess I want to raise a flag to say, this isn't just about big data gathering exercises. This is often about sort of smaller, really good studies that unpick, what's happening and why it has the impact that it does.
Okay, marvelous. So some big insights into the culture between social science and health and nutrition research for sure there. Simone, is there anything from their virtual audience?
We have 2 questions from Twitter. The first comes from Earth Health Sensibility, and the question is, how important could our women-led agribiz in Myanmar be counted? And the second question was just an inquiry about where the full review will be able to be found, if it's available now online or where it will be once it is available.
Okay. Well, we can store those. I think those will be relatively short answers. Let's go back to the room. There was somebody over here. Yes.
Hi, I'm Hannah Gaidenay from ACDI VOCA. I just had a question in terms of the recommendations you had and the implications from it. If in developing those, you looked at the market systems around these agricultural households and the provision of, plowing services or the provision of different harvesting services to time use, if that was considered at all. And I also give a little plug for the ACDI VOCA with LEO, the USAID-funded LEO project, has developed a guide for implementing the findings from the Women's Empowerment and Agriculture Index. And that is available on the ACDI VOCA website, and they're soliciting feedback from people who are using the guide and putting it into the practice. So that's a useful tool, I think, to look at, too. It provides recommendations for how to use the index. So just a question about market systems.
Okay, no, thank you, Hannah. And that was one of the questions was about a kind of market value chain type project. Yes, please.
Thank you. Kate Scaife-Diaz from TechnoServe. I had a question about any feedback loops you might have found between agricultural practices, time use, and nutrition. As an example, from one of our projects in Honduras, we found that increasing adoption of an improved bean seed was really contingent on women's appreciation of the seed itself in terms of hulling it, the cook time. If it took longer to cook, that was not going to be a bean that they were going to continue to work with, and obviously the taste of the bean upon cooking. So if there was any other examples of that you might be able to share with us. Thank you.
Anybody else with a burning question, or should I go back to the panel? Okay, I'll go back to the panel. So there's a kind of cluster around kind of agribusiness, agricultural services, how they're going to impact on this, practitioner type, ag practitioner type things, and then this feedback loops with kind of nutrition. I'm not sure who wants to start. I'll give Krista and Mark the kind of last word, I guess, as the.
I mean, perhaps if we do the last question first, because I think this issue of feedback loops, and Mark talked about this in his comments, that there is a very important link between agriculture and nutrition. It works in both directions, in the sense that nutritional status affects how well people work in agriculture, but also this issue of time, the time availability affects how much time women and men have to put into agricultural projects. Actually, a key finding, and perhaps I should have said this in that overall presentation, is that when we looked at the best evidence on women's time use, agricultural activities were often quite a small share of that. Women were heavily engaged in a whole range of other activities, and in the midst of that, they had to make time for agriculture. So I think there is very clear evidence of the potential for those feedback loops. I think what's missing is the detail. I'd love to hear more about the detail of those kinds of issues being raised within projects, because that kind of really gives us the clear examples of where that feedback happens. But yes, that sort of broad picture is there, and it's clear. When women's days are stretched to the extent that they are, it's unsurprising that we have to look at how they can, what the interaction is between all of these different activities.
Okay. So what about the kind of implications for agricultural development as we see it now on time and on nutrition? We know that at least 50% of the investment that goes into the ag sector is really around kind of value chain or those kinds of service, very practical type. What's the evidence there? Sarah, do you want to say something?
Yeah, perhaps I can add something on that. So in our review, I think one of the other gaps that we have identified is that we have found very few, almost no studies on that looked at interventions in the sort of food processing area, you know, like, so it was mostly like interventions, you know, like to increase or intensify, you know, like agricultural commercialization and productivity, but there were very few studies, you know, that looked at other segments of, you know, like the agricultural, like, and food value chain, if you want. So that, like, is something that is important to mention. Yeah, I mean, I wanted to add something also about, you know, like that perhaps is more a general reflection, you know, like on the use of systematic reviews, you know, like, and links back, you know, like to look at the bigger picture, you know, like as Mark was pointing out, like in his talk. So clearly, you know, like when we were interested in understanding, you know, like the impact pathway, you know, like which is something, you know, like slightly different from what other systematic reviews, like in these areas and others have done in the past or previously, which is to look at the impact size. You know, like we wanted to study the underlying mechanisms, and clearly to understand this, it would have been important to include. You know, like more studies and also studies that didn't look at time use in relation to agriculture and nutrition only, but for the nature of, you know, like the systematic review method, we had to exclude those studies that perhaps, though, you know, like would have told us, you know, like a lot more about the underlying mechanisms of the pathway, like we wanted to study.
Okay. Now, Krista, this might be a good point for you to jump in, because obviously Feed the Future has all kinds of kind of agricultural development interventions. You've got the way, what do you see the opportunities, and maybe you've got a bunch of researchers here, maybe you can develop something with them while we're sitting here.
So I do think, and this has come up frequently, that getting beyond agricultural production and going beyond the harvest, these are areas where we need more research in general, more research on time use. And I think, you know, not only with the processing, we know that women are generally involved in much of the processing, the milling, the cooking, the threshing, but also increased marketing and trade, increased contact with markets. Those are things that are definitely going to have nutritional implications as people move physically to different locations. That has childcare implications. It has implications for what different kinds of foods and dietary quality you have access to. So I think there's a lot to unpack there, not only within time use, but very much linked with this, you know, pathway or collection of things if we're not using pathway. The TechnoServe question, I'm not sure I see it as feedback loops necessarily. I think the way you put it in terms of women really appreciating the value of the seed, of the bean. If you're going to have a successful agricultural intervention, it has to be something that people value, and nutrition is often one way to go with that. I was in Ghana about 2 months ago, and there was a wonderful example where women were telling us about their first year growing soya. And they said, you know, yeah, it took more time. It takes more time to grow this soya than it does to grow ground nuts. And we are working more than we did. But we like it because, yeah, we have, you know, more income that we can sell in small amounts and, you know, decide what to do with it. But also, we can use this soya for a lot more things than we could with the other crops. So it wasn't so much a feedback mechanism. Yes, it's more nutritious than other things, but it was really understanding, if I'm going to do an ag intervention, what do the people I'm working with see as valuable? And nutrition is going to be one of those things. For Hannah's question, ACGI VOCA, I don't have an answer, but your advanced project could get one day. I admit I have a bit of a data crush on the advanced project. But that raises that there are different kinds of time constraints. So there's, you know, in general, women and men are busy with daily life, with agriculture. But then there are also these very important bottleneck times around land preparation, around planting, around harvesting. And what happens there in terms of time use can affect your whole season and, you know, seasons after. So that, I think, could be another place to understand, you know, is that a different kind of research? Is that a different kind of data and methodology that we need to be looking at?
Mark, do you?
Yeah, I'd like to come in on this one. The review says that one of the coping mechanisms is increased reliance on purchased food. Now, this actually raises a whole different Pandora's box of who pays for that, who has the money, who earns the money, who decides. And I'd like to just tie that in briefly with the agribusiness question, because in a sense, the question was women-owned agribusiness. Now, if that happens, presumably you can say the women get the benefit of their own agribusiness. But the real world tends to be not quite as straightforward, and maybe there's more family agricultural work. We know from other literature, it's not per se a time issue, that there's a massive disconnect between the work women do and the benefit they obtain. So until we deal with that, you can't simply say, we're going to rely on more purchased food. And that's also a way in which you engage men in terms of aggregate household welfare to say, these are expenditures that matter for the health of our kids. But it's not as straightforward as simply saying, put the resources just in the hands of the women and all will be well. Thanks.
Thank you. I would like to build on that. I'm going to take Chair's prerogative to ask a question to kind of get you to finish off, which is, and it's fairly personal for me. So I've lived in East Africa for most of my adult life. And if I think of the dynamic change that's happened there from the time I first went until the time, and until now, it's just stunning. I mean, you don't recognize things. So I wanted to ask you a little bit about anticipating in the future, because research in a sense has to be a future-looking thing. What are the big questions related to this study? But also, I mean, Mark raised the point about empowerment. There's going to be all incredible social, cultural change that's taking place. What are some of these key issues we need to pay attention to? We talked about purchased foods. You mentioned that it wasn't very visible. Actually, it's getting pretty visible. In terms of the size of people, it's not just here. And so, what, you know, maybe one thought, you know, the future, and we're planning our next research phase from 2017. What are some of the big issues you see in this space that we should think about? And maybe I'll give you each a shot. Can we start at you, Sarah, and work this way and give Krista the last word?
Yeah, sure. So, I mean, reflecting, you know, like on the issue of purchased food, I think, you know, like it would be important to sort of put resources, you know, like into understanding and analyzing how these changes are happening, are taking place also in rural areas and not only in urban ones. And as it was mentioned previously, in our review, we had to exclude a lot of these studies on the relationship between time use and nutrition because they had an urban focus, and our review looked at rural areas. But I think, you know, like there is evidence that purchased foods you know, like are available in rural areas as well, in the, you know, like low and middle income countries, you know, generally speaking. And so, you know, like in terms of the big questions for the future, you know, like for me, like one would be to look at these changes in rural areas.
Thank you. Lizzie.
There's so many issues, it's hard to know which ones.
You only get to pick one.
I think, well, as Deborah mentioned towards the end, one of the key issues in terms of research is to really understand in much greater detail, you know, what people are actually eating. Deborah highlighted the fact that there's a surprisingly limited number of studies that do look at nutrition in rural areas and look at food intake. And here I'd like just to emphasize the importance of qualitative understandings of household dynamics and of food consumption. What we've found is that in a systematic review that's also incorporated qualitative data, that some of the qualitative approaches do offer a more nuanced perspective of those dynamics than that would otherwise not be available. So I think in the future, yes, combining quantitative and qualitative methods to understand in detail what people are eating and how that's changing.
Oh, well said. I like that one. Okay, Deborah.
I think I'll pick the issue of market integration, not least because John kind of led us to the area in his kind of description of those really dramatic changes in East Africa that are happening elsewhere as well. And I guess it goes back to this issue of what happens with the development of value chains. And when I think about East Africa, I see the development of two kinds of value chains that are linking to domestic markets, the dairy value chain, and chains that are linking to international markets. Green beans, probably the best example. And I guess the issue for me is exactly what we've said, more and better research that helps us understand not just how the people who are participating in those value chain projects or in those value chain practices, so that we understand how those people are faring in terms of their welfare broadly, and particularly in terms of nutrition. But that wider picture, what's happening to markets in local areas? Do they benefit because the dairy industry has improved? Is it local people who are drinking that milk or eating that yogurt? And I think there's a real failure often to do that, to actually say, what's the wider picture in terms of the benefits of market integration.
Thank you. I think actually for dairy we probably might have a better idea than some of the other ones, but that's good. John, Mark, sorry.
I can be John for the day too, that's all right. What will it take to make nutrition a men's issue? And is nutrition a way to cement or strengthen men's engagement with the health and welfare of their families?
And I have to follow that. So I would say, as we are collecting more information about time use and learning more about it, let's not forget to ask the question, who is deciding what people's time use is going to be? How are those decisions made? Are they made jointly, independently? Who is involved in that? And also, from a programming perspective, yes, we need to understand what people are already doing with their time. We need to be able to anticipate, how they might respond to different interventions and programs. But I think we also need to do better to understand from their perspectives, what do they see the trade-offs as? What are the options that they want for their time?
That is very nice. So I've asked for 5 things and I got 5 marvelous things from you. I'm really impressed. Is there any final burning issue, or shall we close? So first of all, thank you to Deborah and team, including Hazel, for a really nice study and very well presented, and I think clearly laid out, which has been very helpful to all. Krista and Mark, thank you very much for your insightful, pleasant, humorous, and challenging comments. Thanks for the discussion, for all of you who attended and for your discussion, and thank you all. And maybe, Deborah, you can just tell us a little bit what's intended in terms of putting up the study and stuff, because that question did come up online, and it would be good to know.
So this will be an IFPRI working paper, and so please keep looking at the same space on the website where the blog post is presently, and so that working paper will be hosted there. And we have some sort of other intentions to perhaps make this a summary. It's a reasonably long document, and it would be nice perhaps to have a shorter summary of it. And so, and again, on that same web space, then you can find other resources.
Okay, so that's the Gender Nutrition Information Exchange, which is meant to be a resource for these kinds of issues. So thank you all very much.